World Health Organization is arguing that Omicron may provide some stabilization and normalization in the wake. I mean, we were talking about this a couple of months ago, actually. It's possible. It's possible. Hope springs eternal again. That because we have had so many infections from Omicron in this country, and this is also the case in Europe, the week of January 18th, approximately 1 million children in this country infected with COVID. We've had millions of cases. We're over 2,000 people dying a day in this country from COVID. And just a reminder, the trajectory of this country was completely altered. We killed, depending on whose numbers you want to use, hundreds of thousands to 1 million people. We created millions of refugees, spent trillions of dollars because we were attacked on 9/11 and over 3,000 people died. We're losing over 2,000 people a day to COVID. Just to put it into some type of perspective there. Obviously, COVID and terrorism are not the same things. But in terms of human life, that's what we're dealing with.
And in terms of reaction.
In terms of the reaction. And
the cognitive dissonance that one can, like when the dead bodies are piling up in hospitals and our healthcare workers and nurses have to bear the brunt of it, people are a little bit more okay with it.
I mean, the most raw deaths recorded worldwide, and not a great per capita numbers either.
In America. In America, yeah. And piece out today in Salon, and you'll recall that Mark Allen Derry, epidemiologist, runs the biggest Medicaid provider in Louisiana, had said that he was looking at, from what they have observed down there, and there's no hard data on this yet, that long COVID takes place in anywhere from 10 to 15% of the cases. And Salon, there was a piece just the other day, I guess it was 2 or 3 days ago, that suggests 10% of children with COVID-19 become long haulers. That can last, generally 6 months. Some go much longer than that. It can involve a wide range of stuff. There are different studies about long COVID that range from essentially 1% to 66%. In the piece, they say there's growing consensus that somewhere around 10% of COVID-19 cases in kids turn into long COVID. So in this country, if that is the case, in the week of January 18th ending, you will have approximately 100,000 kids under the age of, I think, 17, who will have long COVID from anywhere from, months. I mean, sometimes it could go longer than 6 months. That's a lot of kids in that week. The Israeli Health Ministry announced results of a survey showing that 11.2% of kids reported symptoms of long COVID. In the UK, the Office for National Statistics estimated that 12.9% of children 2 to 11 years of age and 14.5% of children 12 to 16 years old still experience symptoms 5 weeks after infection. There's some speculation that the reason why it's higher for kids 12 to 16 is that they can express that they have symptoms better than, let's say, a child who's 2 or 3 or 4 or 5 or 6. One of those doctors said, I suspect it'll end up being about 10%. Dr. Alexandra Yonts, director of the post-COVID program at the Children's National Hospital in Washington, D.C., said based on her knowledge thus far that yes, as many as 10% of all pediatric COVID cases turn into long COVID. My best guess is 10 to 20%, says Dr. Sindo Mohandas, pediatric infectious disease specialist at Children's Hospital, Los Angeles. Now, all of these doctors are, of course, in the pockets of big medicine and big COVID.
And big Fauci, right?
And big Fauci.
He looms over all of this.
Yep.
Small man casts a large shadow.
One in Washington, D.C., one in L.A., the Israeli Ministry of Health, the UK Office for National Statistics. They all are in big Fauci's pocket. And that's why you get these numbers. The American Academy of Pediatrics reported that more than 981,000 new COVID cases confirmed in children in the United States during the week of January 13th. Obviously in big Fauci's pocket. Dr. Moshe Ashkenazi, director of the new ward specifically for pediatric Omicron patients in Israel, told the Times of Israel, from previous waves, we believe 7% to 10% develop long COVID. But with Omicron, the numbers being infected are so high that if even just 1% of infected children get long COVID, it'll cause more pediatric long COVID cases than Delta. Again, mouthpiece for Fauci. Fauci speaks many, many, many languages.
You have to if you're a globalist.
Yep.